So today I'm talking a little bit about current and future applications of brain-computer interfaces. So I'm sitting at the moment in Austria, but we have also branches in different countries, like in Barcelona. We are also in Albany, New York, and we're also in Hong Kong. And we just started this week also in Canada, in Vancouver. At the moment, we are active in about 15 different research projects, and they all have to do with brain-computer interfacing. In recovery slag, for example, we use brain-computer interfaces for lower limb stroke rehabilitation, and in g.tec, we use brain-computer interfaces for coma patients to figure out if they have communication left over. But we do also a lot of work with electrical stimulation of the brain and magnetic stimulation of the brain for neuroscience investigations, but also to make our rehabilitation systems better. And here you can see a very nice art installation, which was done by Dragan Ilic at Ars Electronica. This is a huge electronic art festival, and he hooked up a brain-computer interface to a Guger robot. That's an industrial robot. And he fixed several hundreds of different colors to the robot. During the festival, visitors could actually draw these paintings, and interestingly, afterwards he sold the paintings for £25,000 in London. And another application is shown here. So this is the winner of the Cyberthlon when it happened in Zurich in Switzerland. So it's a kind of Olympic game for handicapped people, and there's also a brain-computer interface race. This person, for example, was winning the Cyberthlon event. So in principle, we are providing different technology for equipping a brain-computer interface lab. So normally you are putting a person into a chair or a bed, then you are connecting him to one of the biosignal amplifiers, where you can measure between 1 and 1024 channels, and then the brain-computer interface is analyzing the data. You can control, for example, a computer screen, a head-mounted display, or you can also work with 3D power walls for highly immersive feedback. And at the same time, you can do electrical stimulation of the brain or of the body. You can do haptic stimulation, audio stimulation. You can use microphones, eye trackers, or push buttons to read out information of the person. But you can also control exoskeletons or rehabilitation training devices. And all these elements are speaking with each other to build up closed-loop experiments. And one of these applications is shown in RecoverX. This is our brain-computer interface for stroke rehabilitation. In this case, the stroke patient is equipped with a brain-computer interface system so that we can pick up when the person is imagining left or right hand movement in real time. Then we show an avatar on the computer screen in front of the patient, and in this case the avatar is asking him, for example, to imagine a left-hand movement. So the patient starts with the imagination of the movement, the brain-computer interface picks it up, and then we trigger a real-time functional electrical stimulation of the left hand so that the hand is really moving. And you can expect the patients like it a lot if they were paralyzed for a couple of years, if the hand is moving as soon as they are imagining the movement. And this is something that works highly effective. And I can also show you a video so that you get the impression how this looks in reality. So here's a stroke patient equipped with the brain-computer interface. The computer screen is in front of him, and there's a little arrow prompting him which type of movement imagination he should do. So he is now imagining the left hand dorsiflexion. The brain-computer interface picks it up, and then we stimulate the left hand. This is now more interesting because it's the baretic hand. You can see it takes about 1 second for the brain-computer interface to pick it up, and then we provide the stimulation for 4 seconds. So it's randomized between left and right hand movements, and one person in total does about 200 hand movement imaginations in one training session. And we are repeating it 25 times. So one person comes 25 times into our rehabilitation center to get this brain-computer interface training done. And last September in our own rehabilitation center here in Austria, we did also the 10,000th treatment of this therapy. which is just very nice. So we have many patients lining up, and I'm just showing you one example. So this lady here had a stroke when she was 38 years old, and the stroke affected her right hand. And then she was at home, unemployed. Her salary was paid by the social security system, and she couldn't do anything for 14 months with her paretic hand. Then she came into the recovery therapy, and on the left-hand side, you can see the classification accuracy that we can extract from the brain-computer interface. So this is showing us how well we can discriminate left-hand movement imagination versus right-hand movement imagination over 31 training sessions. In session number 1, you can see she reached about 65%, and then the accuracy got better and better, and finally she reached even accuracies above 90%. So she learned very nicely to control the brain-computer interface, but also important is to look at brain plasticity. So here in session number 1, we can see that at the red vertical line, she is getting the instruction to imagine left or right hand movement, and then the green and the blue curve are showing how well we can separate the left and right hand movement imagination from each other. So you can see it takes about 3 seconds for the brain to do it, and then we find a difference, but it's not very big. And in session 31, you can see that she is able to switch on the sensory motor cortex immediately within 150 milliseconds. The difference is much bigger. This is showing us how well the brain is adapting. And on the bottom, you can see event-related desynchronization maps. So they are showing us for the left hemisphere and also for the right hemisphere how much alpha and beta changes we get. You can see here that the healthy side shows more red points, so this is good. The paretic size is almost white. There's not much activity happening, but in session 31 we find a lot of red color. This means the left and the right hand sensory motor cortex are really active, and this is the brain plasticity that we actually want to produce with the brain-computer interface. And besides these BCI parameters, we are also doing many different tests for objectively describing how much improvement we get. And one of these tests is the Vogel-Meyer test for upper extremity. You can see, for example, that before the training she had 56, afterwards she had 62 points. So we got a couple of Vogel-Meyer points increase. But much more dramatic in this patient is the improvement in fine motoric skills. For that, we are doing the 9-hole peg test. In this case, the person has to stick little sticks into certain positions, and we are just measuring the time. You can see for the healthy hand, she needed 17 seconds in the first session and 14 sessions after the training. So we also found an improvement of the healthy side. This is something that happens very often for all of our patients. And on the paretic side, you see this dramatic improvement. In the first session, she needed more than 7 minutes for completing the test. And then after the recovery training, she could do it in a little bit more than 1 minute. So this means the fine motoric skills were highly improved. And you can also see for this patient, it was really quick. So already in session 3, she needed a little bit more than 3 minutes. And in session 5, she needed 1.5 minutes. So within 5 training sessions, her fine motoric skills were coming back. And this was 14 months after the stroke, where normally physicians tell a patient that there will not be any improvements anymore. Here you can see a video of the 9-hole peg test, how it looks after the recovery training. You can see the test is pretty difficult, so you have to grasp these pegs, then you have to rotate it and move it, and stick it into the certain locations. And this is for somebody who needs 1 minute and 14 seconds for completing the test. A normal healthy person needs about 20 seconds for doing it. And on the right-hand side, you can actually see the first haircut that the patient was giving to our physiotherapist after she got the recovery training. Look at the paretic side, it's the right hand. So she is very nicely able to do it. And after the training, she could even open her hairdressing studio again and continue her work like before the stroke. But on the surface, the EEG resolution that we get is very limited. And that's the reason why people are also implanting electrodes directly on the cortex. And here I'm showing you a slide from Kai Miller, who is at the moment at Mayo Clinic in the US. And here on the cortex, you can see these white and black dots. These are ECOG electrodes. In this case, he implanted 64 ECOG electrodes over the sensory motor cortex. Then he was asking the patient to be at rest, and he calculated the power spectrum that you can see here in blue color. And then he was asking the patient to do a hand movement. He calculated the power spectrum again. And of course, it's interesting to compare the resting with the hand movement. And here in the low frequency band, you can see there's more energy in the resting phase than during the hand movement phase. And this is the event-related desynchronization that we can also see with EEG recordings, and this is also the signal that we are using for recoveries. Interesting is also that the large cortical area is involved in generating this low frequency band. But if we are moving to higher frequencies, around 80 to 100 Hertz, this is called the high frequency band, and we can see exactly the opposite. During the hand movement, we have more energy in doing resting. This is called task-related high gamma activation. And interesting is also that one single electrode is coding this hand movement in this case. This is something that we are using also in a system that's called Cortec-U. So this is for neurosurgery, for tumor patients and epilepsy patients. And it allows us to find the eloquent cortex within a couple of minutes. So in this case, I can also start the video. On the left-hand side, you can see the ECOG recordings coming from the implant on different regions. And on the top right-hand side, you can actually see the instruction that we are giving to the patient. So in this case, we ask him to relax, just sit there. We record baseline high gamma activity for 15 seconds, and then we ask him to stick in and out the tongue. So he is looking at the image. This is firstly activating the temporal base because this is the region responsible for identifying shapes and colors. And afterwards, we can actually pinpoint here with these red bubbles the region that's responsible for tongue movement by analyzing the high gamma activation between 80 and 200 Hertz. Then the patient is listening to a story. In this case, he's just sitting there and just listening, and we were showing this loudspeaker symbol first. That's the reason why we get the activation of the temporal base. That's the region responsible for shapes. And afterwards, we find the activation of the auditory cortex and of Wernicke's area because he is able to understand the Japanese language. And the final task is to solve Rubik's Cube. So in this case, he's firstly seeing the shape and the colors. This leads to the activation of the temporal base, and afterwards we find the finger regions over the sensory motor cortex. And this is actually the information that the neurosurgeon needs for deciding which regions he should not remove. If he would cut out, for example, this bubble here, then the patient wouldn't be able to move the fingers anymore. And this is something that we can map very rapidly within 5 minutes. The standard procedure is electrical current stimulation. So in this case, you are stimulating different brain parts, but this takes 1 or 2 days, and you can also induce seizures. This signal is also something that very nice that we can use for brain-computer interface control. So in this case, we have the neurosurgeon, Dr. Ogawa, in front of the patient who has high-resolution ECOG grids implanted over the temporal base. So we have 32 channels on the left hemisphere, 32 channels on the right hemisphere. And the brain-computer interface is analyzing what the patient is seeing. And on the screen here, you can actually see what the brain-computer interface decides. This is, for example, a face. It's a symbol, and here you can see actually the symbol that the patient is seeing. It's another face, a symbol, face. You can see this works in real time. We are actually quicker decoding what he's seeing before the patient is realizing what he's seeing. It's also very interesting. He's seeing now himself. It's a face. This is Christoph Guger from our company. It's also a face. That's also interesting. He was already used to Dr. Ogawa's phase. That's the reason why we don't get initially high gamma activation. He has to prompt the patient who is phase to generate this high gamma activation. And at the moment, we are able to decode 18 different types of symbols in real time with this setup. And very interesting is also that we can calibrate the brain-computer interface on artificial data, and it works also in reality, like we have demonstrated here in the video. So we calibrate it on information on the computer screen, but it works also with real faces in real time. This is just very nice for doing such experiments. And when we are coming back to EEG, then of course the EEG has a very limited spatial resolution because EEG electrodes are about 2.5 centimeter, about 1 inch, separated from each other. And for that reason, you cannot do many tasks that you could do, for example, with ECOG signals. And that's the reason why we developed the Pangolin grid system. It's an ultra-high density electrode system, which consists of 16 electrodes shaped like a polygon. So every dark circle here is one electrode. It's connected to a preamplifier, so it's a kind of active electrode. Then it's connected to the main biosignal amplifier. So here you can see a real image on a human person. So we can record in total 1024 channels with the Pangolin system. And just over the motor cortex, we can have, for example, 384 channels. And this is giving us much more spatial resolution than you can achieve with any other EEG system. This is very interesting, of course, for neuroscience experiments, but also for brain-computer interface experiments, because we can, for example, find difference between single finger movements with EEG recordings, and we don't need an implant. And we worked also together with a fashion designer, Anu Quickbrecht, who lives now in Florida, and she designed this Pangolin scales dress, which has many actuators. And I can also show you a video how this looks like